Welcome back. February is Heart Health Awareness Month, and joining us virtually right now, we have Dr. Haq. He is a cardiothoracic surgeon with Our Lady of Lourdes. Thank you so much for joining us this afternoon, Dr. Haq.
Thank you for having me. I appreciate it.
Of course. So for viewers at home, let's just give a quick rundown on cardiovascular disease.
So basically, cardiovascular disease is any disease process affecting the heart or the major blood vessels, either entering or leaving the heart, and then the blood vessels as they supply other parts of the body. But what I deal with primarily is the diseases of the heart, of the arteries supplying the heart muscle, of the great vessels that leave the heart, and of the heart valves.
Yeah, and cardiovascular disease, I feel like it can impact a lot of our viewers. Are there warning signs that people should be on the lookout for to come and get checked?
Yeah, absolutely. The main warning signs are symptoms like shortness of breath, becoming easily tired, passing out, chest pain, those kind of things. But there's also a lot of problems that can arise and the patient's free of symptoms. So I think it's important sometimes as we age to, kind of get involved in screening events where we can catch things soon and treat them as they need to be treated.
Yeah, absolutely. And these screening events, how often do you guys at the hospital provide those, or should they call ahead and make an appointment for those?
So we do actually. I mean, the easiest way if you're having any kind of symptoms, I would say, is reach out to your primary care physician or your cardiologist. We have resources through Lourdes on our website. If you go to lourdesrmc.com/heart, there's a free risk assessment where you can put in some of your own characteristics and it'll tell you what kind of risk you're at. We also have some heart healthy information available there that you can kind of go through to help guide your lifestyle changes and so on. But the community screening events are held pretty frequently. The next one, I believe, is March 4th in New Iberia. And then we also have them here at Heart Hospital.
And for people at home, what is something that you would like to share? Maybe a piece of advice or a word of wisdom. You mentioned there's different lifestyle changes that people can make. What is something that you would like to share with our viewers today in regards to that?
Well, I think the biggest things as far as lifestyle modification, number one, if you smoke, stop smoking. Number two, this one hits close to home for me. I like to eat, so I think the principle I go by is kind of everything in moderation. So
Yeah.
I don't like to give up certain things, but to try to keep everything in moderation. And then you can't stress enough the importance of doing about 30 minutes of cardiovascular aerobic exercise at least 3 times a week.
And we are almost out of time, but really quickly before we go, why do you think it's so important that we do take care and take our heart health seriously?
Well, I think the best analogy I can give is you can't drive your car without a good engine, and you can't really live a normal life without a good pump or a good heart taking you where you need to go.
Dr. Haq, thank you so much for your time and talking about cardiovascular disease with our viewers today.
Thank you very much. I appreciate it.
Of course.